all, thank you very much for doing this.
Yeah.
And to start with, can you tell us a little bit about how you actually got into AI and how this collaboration with Google came about?
So I guess I've always just been interested in new technologies for a long time, and so the grant funding that I have from the National Institute for Health Research, the NIHR, essentially really deals with the idea of bringing new tech to healthcare, and particularly to ophthalmology, and that could be AI, it could be virtual reality, augmented reality, smartphones, and so anything cool that I would see in the tech world, I would think, is there an application in ophthalmology, and how do I bring that in, and how do I test it and validate it and make sure that it works?
That's brilliant, thank you. So you've obviously had a really big paper come out.
Yeah.
How's the response been to your paper at the conference?
I think the response has been amazing. This is a paper that is 3 years or perhaps even more in the making, and it's like 10 papers all put into one, and it's really the thing that I'm incredibly proud of, and I think it's a career-defining paper for me. And so it's been amazing to speak in these massive venues and have people come up to me afterwards and talk about other collaborations and discuss ideas for the work.
Perfect. So you mentioned you get to sort of look at all the cool tech and see if you can actually test it and so forth.
Yeah.
In terms of AI, how do you think that would actually be helpful? What major problems do you think it could solve?
Well, I think that AI has the potential to be transformative. I think that and that ophthalmology is the first branch of medicine that is likely to be fundamentally transformed by this technology. At the same time, it's not magic, and so I think that there are many areas where it might not work. I think what we've done is identify one particular area, which is triaging of new patient referrals, in the United Kingdom to clinics. And I think that it could help because really we've got a huge problem with capacity on the National Health Service for eye services. So what a lot of people don't know is that we see about 10 million outpatient appointments in eye clinics every year, and that's actually 10% of the total for the NHS, and that's second only to orthopedics in terms of the number of outpatient appointments. And that's also a number that's risen by more than a third in the past 5 years. So we have a huge number of patients. And if we think of just one condition such as macular degeneration, we know that about 200 people develop the blinding forms of AMD every single day just in the UK. So what I would say is that AI will allow us to flag those patients with sight-threatening disease, get them in front of a retina specialist within days, and get them treated soon. And then for people who have less sight-threatening disease, less urgent disease, they would still go and see a human ophthalmologist and be assessed, but it might be in weeks rather than days.
That's great. So I think you're right, there's been a lot of interest in terms of the triaging, but there's also been quite a lot of interesting work in terms of using modelling to see if AI could actually predict outcome.
Yeah.
So the stuff like Tarek's been doing in Manchester. Do you think that would have a role in clinical practice?
I think that there's a huge role for modelling, and Professor Tarek Aslam has been amazing in that regard. And I was really excited to share a podium with him, and he chaired the AI session, which was standing room only. I think that I would see the potential of that first in clinical trials, and I think I think the pharmaceutical companies are really interested in the work that he's done to try and figure out if they change some aspect of a new drug that they're designing, like the molecular weight of the drug, or they look at other properties, can they predict the outcomes? And I think that has a huge capacity to lead to better outcomes for clinical trials.
Brilliant. And in terms of some of the challenges that we still have to address with AI, what do you think some of those challenges are?
I think that we have to be very clear that we've got proof of concept evidence that AI works, but there's lots of ways that it might not work in practice if it's being used all around the world. And so what we need to do now is actually move to the next stage of the process where we get robust evidence in prospective clinical trials to validate what we're doing. And we have to show that AI works not just in people who come to Moorfields, but people who come all around the UK, people who come if you have diabetic macular edema in Ghana or in Sao Paulo, Brazil, or some other country, will the AI work for you? Because if it only works in people who come to the UK, then I think that we would have failed in what we're intending to do.
Brilliant. Professor Schmidt mentioned in a recent review paper there's this kind of odd thing where no one really understands how a neural network comes to a decision, and it can affect how reliable we think that output is. Do you think that's an issue?
I think that this is the black box problem, and I think that one of the exciting things about the paper that we published in Nature Medicine is that we have taken steps to address the black box problem. So it will tell you that it thinks a patient has macular edema, but then also it will still highlight on the OCT scan where it has identified the macular edema. And we think that actually that may be crucial to driving adoption of the technology by healthcare professionals. So, for example, suppose we know that it's got it wrong for some way, and it said that someone's got some macular hole or something like that, but we're looking at the patient, we can't see a thing. It allows us to look and see why has it made that error. And so, interpretability is going to be key going forward.
Perfect. And just to end with, how far away do you think we are from it actually being integrated into regular clinical practice?
I think the important thing is that we've published this paper, but we have to highlight to people this algorithm is not being used in clinical care at Moorfields. This is a proof of concept. It's a piece of research code. As I say, we need to do the clinical trials. We need to have something that can be used in millions of people around the world in real time. And I think that realistically, it's 3 to 5 years before we see that transformation.
So not that far. No, that's perfect. Thank you very much.
Brilliant.